All right, well, this week to start our Monday, we have over 50 patients in the hospital who are isolated with COVID. We have 52 inside the system. We do have one patient in Maryville, and we have 51 patients here. That has led us to occupy the fifth floor, other than just a couple of rooms, and we occupy 9 rooms inside our ICU at this particular time. This is certainly very distressing from a standpoint of just the overall burden it puts on our health system. We have staff, but this is the summer. People need to have vacations, and the staff is stressed. And so what doubly stresses our staff is because folks aren't taking their time off because they feel a sense of obligation to be there with their peers. And so we're not able to get the rest and recovery that we had hoped this summer would bring. So I guess what I'm asking the community to do is, I really want you, if you haven't been vaccinated, to consider that. I'm not saying that if you've been vaccinated that you will not get COVID. However, your risk is extremely lowered. Again, Pfizer is 95% effective in keeping you from getting COVID. Moderna the same. J&J, it may not be quite as high. However, these are your best measures to either one, prevent getting COVID, or number two, to keep you from dying. And that really is the true measure of a vaccine. Do you survive the illness if you still contract it? Because we give vaccines all the time and folks still may contract that illness, but normally it does not kill them. So it gives you your best chance of survival. We are seeing COVID in younger patients now, and these patients are becoming severely ill and requiring hospitalizations. Still, your highest risk is for that age group 60 and up, but we do have patients under the age of 30 in our hospital with COVID who are severely ill. So I need the younger folks to understand you're not safe just because you're not 60 and up. I want them to understand that. We did have a vaccine event last week. A little over 140 people came in to get the vaccine. We're very thankful that they did come in and get their vaccine, and we will conclude their second shot near the end of this month. We are also working on coordinating with the chiefs, another vaccination opportunity, and also will continue to coordinate even here locally to encourage those that have not become vaccinated that may want to become vaccinated, that we provide them with an opportunity more on a walk-in basis. Understand the pharmacies, the local pharmacies, and many of the clinics do have vaccine available, and we encourage that you get there and get your vaccine. But we want to make it available so that people can make it on a time that is more convenient to them. Antibody treatment is still available, and one of the things that folks need to know is that if you do contract COVID and you meet criteria, we do have the medication available for you to be able to get your antibody treatment. We are utilizing all 3 of our hospital sites for this, and a lot of it will be for one, availability of space. So for folks that may live a little closer to Maryville and say they were here, we would probably send them to Maryville for that infusion if they were a candidate, or Albany. And it's again about space availability for these infusions. A couple of weeks ago, we were doing less than 5 a week. Okay? 2 weeks ago, we did 50. This past week, they haven't been able to give me a number, but Wednesday of last week, we were already at 67 infusions. These antibody treatments do help patients prevent hospitalization. Again, not 100% effective, but very, very, very highly effective in preventing this. So just can't stress to the general population the need to take care of yourself, protect yourself. If you're going to be at an event where you do not know the status of the folks that are around you, whether you have been vaccinated or not, if you're going to be in close proximity, please have your mask on. If you're around groups where you know everyone's been vaccinated, certainly we don't have an issue with that, and you can participate in those activities without a mask. But again, in those areas where you're not sure, we would highly recommend you wearing a mask, even if you've been vaccinated. Whenever I walk into any of the larger stores around here, large numbers of folks aren't wearing masks, and I understand that. They may have been vaccinated, and plus there is no mandate for mask. However, if they have any underlying medical conditions that would put them at higher risk, even if they'd been vaccinated, and you happen to be in one of those areas where you may come in contact with multiple people who could be positive with COVID, we would highly recommend you have your mask on in that situation. We believe that the Delta variant is the most common COVID variant that are infecting people here at this particular time. The state does not give us complete numbers. However, they have indicated that the majority of the infections that we are seeing right now is the Delta variant. It is far more contagious, i.e. more easily transmitted than the original COVID variant was, and we are seeing it in the younger adults. And again, some are becoming severely ill. Of those would be the ones that either one have underlying medical conditions, however, not always, but one thing's common, they have not been vaccinated. That would be the commonality there. So with that, I certainly would open it up to any questions that you might have of us. But in closing, I just want to say, I ask you, please get your vaccine, do your research. The caregivers here are committed to being here for you. This is the safest place for you to get care, and we're here to take care of you and provide that care. But you really need to be taking care of yourself, because once you end up in our hospital, if you become more and more ill, your chance of survival goes down. We just have gone through a year and a half of this, and we're about to go through another timeline that I do not know. What I do know is we're at 50 today. A couple of weeks ago, I told you we were headed for 30 to 60. We were at over a 20% positivity rate last week. We will go over 60. We will be closer to 75 is what I believe. If our positivity rate in the community continues to go up. In the past, our highest numbers were just shy of 100 when we were at our peak. We really don't want to be back there. So,
can you talk about, we have 50 in the hospital, how many of those are unvaccinated, and can you give me like an age range, like maybe we have 10 that are under 30, or what does that look like?
So of the 50 folks of the 52 folks that we have in, under 50, probably a third of the patients in our hospital that have been admitted are under 50 years of age. Under 30 are only a few. It would be less than 5, probably. I don't have that exact number in front of me, but still, we weren't seeing that before in what we would consider pretty healthy young adults. We would have an occasional one that had usually multiple comorbid conditions, whether it be high blood pressure, diabetes, cancer. We're seeing young, healthy adults without underlying conditions that are getting admitted. Of the ones that of the 50, we do have roughly, I believe it's somewhere between 5 and 10 of those 50 that had been vaccinated. However, not all had been fully vaccinated. They had only received one of their vaccines in the series. But of those that were vaccinated, we have only had one that has become severely ill and ended up in our ICU, and that patient had multiple underlying conditions that probably led them to become more severely ill. The others usually stay on the 5th floor. They have a shorter hospital stay, and they get to go home. But we are seeing that.
So 5 to 10,
yeah,
vaccinated or not fully.
Correct.
Okay,
Out of the 50.
out of the 50. Is the fifth ward full?
The fifth floor, I think today we have 4 rooms still available, and then we'll move to 4. So we're already getting our 4th floor. Remember, we have 2 floors, the 4th and the 5th floor. So we will move down to the 4th floor, and we'll move into half of that if we need to. And we're already preparing and setting up for that. Just as we have one section of our ICU closed, if we have more ICU patients, we'll have to close a second section, and we have an alternate area that we utilize for an ICU that we will move into.
Can we talk about how fast our hospitalizations are increasing? Because a month ago we weren't in this situation. So can you talk about that and maybe why you think we're in this situation right now?
So in 2 weeks, our census with COVID patients has doubled. 2 weeks ago, we went into the 20s. Okay, and we kind of hovered in there starting last week. We've rapidly moved to 50. We moved into the 30s and up to 50, literally from 30 to 50s within a series, maybe 5 days, that we've gone up that rapidly. With that, what are the reasons for that? The biggest reason is low vaccination rate. The Delta variant is more contagious, so it's more easily spread. And when you have a population that has a low vaccination rate, it's going to spread more rapidly, especially because it just is more contagious than others. People aren't, I don't think, being as diligent about their hand hygiene as we were, and no one's wearing a mask. When you're in large enclosed areas with a lot of people, you're putting yourself at increased risk if you're not taking those extra precautions you were taking before. And that's what I'm asking. I'm asking you to take those extra precautions. Hand hygiene. Wear your mask when you're in areas of unknown status, whether you've been vaccinated or not. Where you have known status or you're around, a known group of folks, you're safer. When you're outside, you don't need to wear a mask unless you're in really, really, really tight quarters. Then if you don't know the status and you're at risk and you have any of the conditions that put you at higher risk, either age, diabetes, high blood pressure, being overweight, these things can really put you at risk. So you need to have a mask on. I know it's not comfortable. I know that people have mask fatigue. However, the number of folks that are now in our hospital, literally in 2 weeks, how we've gone from just in the 20s to 50, should tell everyone, this, once again, we're back in the throes of this. Now we have some treatments. We still have the Regeneron. We're able to do that. So we have some things that we can do. But now we have a vaccine. Yet we have a population here in Northwest Missouri that's less than 30% vaccinated. They are less than 30% completely vaccinated. So those are the reasons why we're seeing this, and we'll continue to see this because the more people that get infected, the better chance this virus has to mutate again and to change. And what will that be? Will it be more aggressive? Will it not? Will it be more contagious? Will it not? We don't know. But we do know the larger number of people that the virus gets into, the better chance it has of changing, which then, puts you at a higher risk.
At what point do we go back to considering making masks more of a requirement? I mean, just in general, is it safe to go to these larger events now or not?
Is it safe to go to larger events? If you're wearing your mask, if you're wearing good hand hygiene, if you think about your surroundings, okay, I think that we can have larger events. Do I think that we need to consider masking? Yes. With everything I've said, I can't say it any different. I think people need to be in masks. We're seeing way too many folks become ill and requiring hospitalization, and some are not going to survive. And we've just gone through this, and everybody's seen the numbers. Over 200 people died in this facility in the last 18 months from COVID. So I really hope that we don't repeat that. So it's time for masks.
Do you
Put them on.
do you believe that we need to put in place another mask mandate across the city?
Do I'm going to say this. That is the mayor and the city councils and even the state government's job to decide something like that. I'm telling you that from our perspective here, walking around, seeing our caregivers, as we see this influx of COVID patients coming again, and we know what that means. They want to see people not become ill. So we need to be wearing masks. What the city council, what the mayor feels that is best for their community, they have to listen to their constituents. All I can do is ask people, I don't know that we need that mandate as much as I need you to wear your mask, especially when you're in those situations that put you at risk.
How many of our 50 are on ventilators?
We have 7 people on ventilators at this time.
I think
2 weeks ago we had 1.
moving forward, I mean, what is your guys' biggest fear? Is it that we're going to get back into that high 90s range? I mean, is that plausible at the position we're in right now?
Right now, that is a fear. If we see, again, so the last 3 weeks here in what we've had a positivity rate of the folks that we test in our region of 18.5%, 18.5%, and just slightly over 20%. At 20, we know we had up to about 75 patients in the hospital at 20%. At 18, we knew we had up at the max 60. There's a range. If that positivity rate jumps even higher, then again, once it goes about that 25 range, it becomes very hard to predict. It's very blurred. We went well into the 90s. Our highest positivity rate was just short of 35%. However, we saw the 90s in that range between 25 and 35% positivity rate in our communities. So that is a big fear that we end up back in that 90s where we have 2 floors of the hospital are full with COVID patients, and we have an ICU that is over half of those 21 beds have COVID patients in them.
No, Buchanan County is the least vaccinated county out of the 15 in northwest Missouri by a lot. Can you talk about why you think the vaccine hesitancy is so strong here specifically?
I think that's multifactorial, and I don't know that I'm going to do it justice. There's a lot of misinformation out there, and I think it's sometimes hard for people to decide who's telling the truth and who's not. I don't believe that it was so politicized early on. The politicians, especially many of our federal politicians, hold culpability because I'm not going to get the vaccine, yet I can't think of any of them that didn't run to the front of the line once it was available. So the misinformation, they may know one person that took the vaccine and felt sick for a day. Well, I don't want to take that because I feel bad for 24 hours. They hear things on TV. Depending on what news they watch, there was one of the newscasts, and it's not a local, it was more of a national newscast, had a person on there that had a stroke, okay, sometime after they had received a vaccine. The problem with that, was it the vaccine? Well, nobody knows. If you really take in age and other risk factors, there's a good chance that one may or may not. Still, the number of folks that are hurt by the vaccine or have a complication from the vaccine or even become ill is incredibly small compared to the protection you get from the vaccine. In this particular case, every vaccine that we have out there today can have a side effect, and they do. And it's in small numbers. If you happen to be the one that has the side effect, yes, I mean, people don't like that, but the majority of the time the side effects are even mild and you completely recover from them. They're not severe. So I think it's multifactorial. I don't think that it's an availability of the vaccine. And I also think that a lot of folks feel like, well, I'm rural enough, it's not going to get here. Well, it's here again. So I encourage them to really read and go to the CDC websites, go to Mayo's website, read about that vaccine. If you go to our website, there are links that you can get to things to read about this. I think some of the information that you receive out there on what I would consider websites that don't really use the scientific data can give you a lot of misinformation.
So, going back over kind of to the Delta strand, what are you saying? Do you think that that is what's affecting the young adults, since now that we have this sudden increase in young adults being really highly affected by it, and since we don't know exactly which strand they have, do you think that might be a correlation, or can you just, I guess, speak a little more to what's affecting the young adults and why all of a sudden it's impacting them so much?
Mm-hmm. And I can't be 100% sure, but it would appear that it would be a variant, most likely the Delta variant. Since it is so much more contagious, and it does seem to affect younger folks more than the original COVID that was here did. So I do believe that that's the case when it comes to the younger adult. I don't know that if you looked at it from a standpoint of is it more lethal than the other one, I don't think we have good enough data yet, but what we do know is younger folks are getting sick, and we are seeing more of them get hospitalized than we did a year ago before this variant was here. So I do believe that it is the contributing factor.
You know, we're seeing a lot of problems in Southwest Missouri and North Central with their hospitals becoming overwhelmed, and a lot of them are attributing it to the Delta variant down there. Do you think there comes a point where we could be in that situation with the Delta variant?
Certainly, we talked about this over a year ago about could we become, are we overwhelmed or not? I mean, right now, it's stressful for our staff because we've gone through this and we know what happens. It's not that we can't take care of the patients that we have. It is always concerning that could we become overwhelmed? Yes, we could become overwhelmed. I don't know that we will, and I can't give you a number. I know over a year ago y'all asked, what's the number? I don't know what the number is. I know that at one time we were almost at 100 patients in isolation. There were more than 100 patients here that had COVID. They had just been here so long they weren't in isolation anymore. And at that time we had probably 120 people in. But what's the number? I don't know what the number is, but certainly seeing what we're seeing happen in Springfield could certainly happen here. We are the hot spot at this particular time. And so it is very, very, very concerning. I can tell you though, this is the safest place to get care. We are being very vigilant. All our caregivers are. Supply chain, we have plenty of personal protective equipment. We have plenty of equipment and supplies to be able to provide care for all of these patients. And we are monitoring this it's more than even on a daily basis. We kind of are checking multiple times throughout the day to make sure that our supplies that we have on hand or that we have coming, so that we meet the needs of not only our caregivers to protect them, but of the patients that we care for. So right now we're in good shape from that aspect. But could we get to a point where we wouldn't be able necessarily to? I guess we could. We're not there yet. And we have our friends Maryville and Albany too that we work with on where we can place patients and utilize those resources. As I mentioned earlier, for infusions, we're already doing that at all 3 facilities to make sure that if you meet requirements to get the antibody treatments, we can either get it done in Albany, Maryville, or here.